Hi, welcome back. Today I'll be talking about the second pillar, the physical changes. We all are aware about the fact that whenever there is any change in our circumstances, our body reacts in a particular way. When we are exposed to a lot of stress or uncertainty, as we have all experienced during this COVID time, that there are less number of jobs, people are falling sick, so many of restrictions that is happening. So all this is playing in our mind, and because of that our body is reacting and responding in a certain way. Though it may not be like it's there for a long time, but we do find it happening recurrently in our body. We may feel that we are tired or fatigued out. There is some discomfort in the chest, the heaviness in the head, or we may also have palpitation or dizziness. Any news we hear, and then there is this turmoil going on inside. Our body reacts and gives us signals that we may or may not accept, but we should take a note of it. So it's like how you identify that your body is giving you some symptoms. That is very important, because it should not be overlapping any medical symptoms. And that is the reason that I would recommend, if it's like happening on and off, then you should consult your doctor. If there is any medical history, then you should take care of your health. The fitness is, of course, the top priority, as health is wealth. We all are aware about it. So if it's like you are feeling tired and fatigued out, and that is the symptoms that the body is sending it out to you. So look back, pause and think, do you have any incomplete work? And it's like, if there is, it's the procrastination part, because whenever we delay the work that we are able to do or capable enough to do, it will lead to some thoughts that will be nagging in our mind that we have to complete, though it may not be important as of it right now, but it is still a part of you that you have to invest your time, and so you need to invest that time and complete it, but you're not doing it. So that could be one of the reasons, that if these thoughts are there in your mind, that there is some work, you have to make some call, something is there, that message that inside you is revolving around and can take away your energy. You will find a depleted energy. You will find yourself to be lazy. You may find lethargic. Your body is lethargic, and there is no inertia even to do the simple tasks that you usually would have done, but now it's like it's very difficult. Not impossible yet, but you don't just have that much of energy. There are some body aches, there is headaches, that is unknown. Sometimes it's just come up. There is this pounding pain on the neck and the head. So all the body is trying to tell you that these aches and pains, if you are having a normal diet, is because of certain reason. Either you are spending your thought process more in the past or the future. That pendulum thing is happening. So about the uncertainty part that I mentioned, that it's about the future. You're thinking a lot about the future, what will happen, what is going to happen, when will all this get over. So that is not in your hand. What is in your hand is what can you do now. So be a little more conscious about what is happening in and around you, and how you can invest in whatever way you can do whatever the work you have with you. So the body aches, the headaches, all this leads to your own thinking and overthinking zone. Be very, very careful about it. I have also uploaded a YouTube video wherein I have specified how procrastination, and then another one how anxiety and worry, you can identify both. They are not the same thing. We usually use it in the same breath, but then it means completely different. In my understanding, and I strongly believe in it, that there is an hierarchy, like, the procrastination is the first step, then will lead your worry part, and then the anxiety part. If you are having a headache a lot, then it's like you are in the worry zone, or you are in the anxious zone. If the body is also taking part in it, you may feel the churning in your stomach, you may feel the increased palpitation, the heartbeat. Suddenly any news you hear, and then you just go into that area wherein you can't even breathe normally. So it becomes difficult. You may have dry mouth, rapid breathing is there, you are feeling very, very uneasy. So all this, if it's happening related to your breathing, related to your headaches, then do make a note of it as to when it is happening, because these are the signals your body is giving to you that you are taking in or absorbing things which you should not, because it's affecting your day-to-day life. Your routine is getting affected. It's not that you just think and you forget easily. It will take considerable number of hours of yours, and you will feel in that discomfort place. That is absolutely not necessary. That bloating feeling is there. The diet will decrease. You may not feel hungry, or it could also be that you may feel too hungry, and it's like you are having something or the other, munching something or the other on and off. So you are overeating. That is also possible, because again, no two people eat the same way. So everyone has their own body metabolism. That could be possible. You may have the chest pain. So these are the signals your body will give to you. So now if you receive the signals, what should you do? Like if example you have a body ache, headache, heartache, heartburn, acidity, rapid breathing, sweating, dry mouth, etc., any physical symptoms that you are having, then the first thing you should do, if it is happening on and off, you should consult your doctor. If you are already taking some medicine, do take it at proper time with proper food. It's not just popping in the pills and then expect it to give some ease to you. The food is very important. You should be exercising. If you have the headaches and if any of the physical symptoms that I mentioned or otherwise, I would highly recommend you all to start on your exercise ASAP, maybe on the spot jogging or squatting, or you can have some push-ups, skipping. Best is going out for a walk. If it's difficult, then it's like if you cannot walk, then run. That is the best thing. But do any of the physical activity. Cycling is one of it. Swimming is another. But do spend some time on exercise. You can also play badminton or any sport game. Have your vitamin D and B12 checked. When you're having your blood test done, a general CBC, remember vitamin D and B12 is not included in CBC. You have to mention it that I want to have these tests done. So the payment is separate as compared to what you have in for the CBC. Then the next thing you can do is immediately, whenever you are feeling like your palpitation has increased or you are feeling discomfort, just sit pause, close your eyes, connect with your breathing pattern. Whenever you are taking in the air and your stomach should be coming out. Just place your hand on your stomach, breathe in, close your mouth and breathe in. Your stomach will be coming out. And when you breathe out, your stomach will go inside. So it is possible, and it has been observed that people, when they are really nervous or they are not in a comfort place or they're not feeling comfortable, then their breathing goes haywire. It is very normal. So get back to your breathing, check on your breathing. Even right now, you can check your breathing, how it is. So when you take in the air, the stomach should go out. And when you are breathing out, your stomach will go in. That is the correct way of breathing. You should sit straight and breathe. So that is one of the things. Second thing, then the next thing is not the second thing, but the next thing is if you have acidity. Remember, it is also again a reflection, as I had mentioned in my first pillar when I was talking about the behavior and the food aspect. I will again be revisiting the food right now also, but then it is some work which is not done, some emotions, some memories, some thoughts which is not resolved. You hold it too close to your heart. It could be any hurt part, anyone says something. So emotionally there is this inside you, let's say a storm inside you, which is there, not obvious to anyone else, but you only hold it inside your mind. Somebody says something. So all that will result to acidity when your emotions are escalated. So be careful about this fact also. And if you have a spike in acidity part, then just think for a moment, did something happen? Am I overthinking? Has anyone said to me something which I do not approve or I did not like? Think. This is your body, and if it is telling you something, take a note of it, because it's not a very good thing to be on medication. First, try to find out the reason for yourself, because it is very easy to get off all this and resolve the issues. It is easy. Therapy does not mean that you are dependent on the sessions for a long time. It's like addressing your issues in a non-judgmental way and resolving it and moving on ahead in life. So that is that. Then it's like the food part that I had said. If you have any of the physical symptoms that your body is indicating to you to take a note of it, then do take a note of food. Food is the crux of everything, of your own existence. You cannot neglect it. Breakfast is important, and I keep on saying it repeatedly whenever I have the opportunity to talk about food. Breakfast is important. Maybe you are having a same type of food, like only calories, but there is something more quantity of calories, or maybe more quantity of any type of food, or it could be you are allergic to any particular food, or it is possible that you are having long gaps in your food. That is very important, because nowadays either you are munching abstract things on and off and diluting your own main meals. That should not be happening. The quantity and the quality matters a lot when you are having your food. take a note of that, and I'm sure you will be able to manage the acidity part, because as I had mentioned, it is the emotions and the food. These two things are the key that will lead to your acidity part if you are not resolving it. If you're just neglecting it, oh, it's okay, I can manage things, but your body cannot manage that. Remember, it is going to be affected, and it is giving you the signal before it becomes anything more complicated. So think about it. Your body, the physical aspect of your body is a very important thing. You should be fit. That will lead to your healthy mind. You can also have Live 52 for a month or so if you have a lot of acidity and all, or if you're a very emotional person. Then for a month, Live 52 at night, Himalaya or any safe medicine, you can ask your doctor. You can have it for a month and then you can get off it, because liver is the seat of emotions and it should be taken care of. One day I'll be posting a video on liver itself, because it is the most neglected, yet let's say the center of our body. It holds all the organs in its proper places as far as functioning is going on. It removes the toxins from our body. So that needs separate time. For now, you all should know that physically, if your body is sending you any signal, do not neglect it. Do not just take it for granted. If you're having any aches and pains, look back, monitor yourself. It has to be one of the areas that I had mentioned. It could be food, your thoughts, emotions, or your work. Any one of them. It could be something else also, but then you will be the best judge of it. And my wishes to you all: be healthy, take care, and be safe. See you in my next episode, and I'll be talking about the third pillar, the emotional change that is happening because of this COVID time, or it can happen whenever we have any change in our own circumstances. So stay tuned and stay safe. Bye.